While the state of healthcare in rural areas has been thrust into the spotlight due to COVID-19, the Rural Healthcare Advocacy Project says rural health facilities have traditionally not been as well funded as urban ones. Well, let's find out how they're coping. Joining us for this conversation is Russell Rensburg from the Rural Healthcare Advocacy Project. Russell, good evening and thank you so much for your time. I wonder if some of the warning signs that are coming out of a province like the Eastern Cape gives us an indication of exactly how some of the more the provinces with more rural constituencies have been affected by COVID-19.
Yeah. Thank you, Cathy. You know, rural provinces generally have quite wide areas that they have to cover. So one of the challenges is really the distribution of capacity. With a lot of the capacity being concentrated in cities. And in a province like the Eastern Cape, I think a lot of the challenges that already existed before COVID. We'll know that the Eastern Cape, for instance, spends a big portion of its budget in settling medical legal claims. That money comes from its operational budgets, which means that it hasn't been able to invest in the kind of health system capacity that is needed just to basically meet basic healthcare needs. But when you have a pandemic like COVID, it throws everything out of the mix, and the kind of demand placed on facilities becomes much more intense. And you need a strong coordination plan to respond to that. And we haven't seen much of that, at least in the Eastern Cape so far.
Which other areas would you say are being affected by the same phenomena and capacities really coming under incredible strain?
Look, I mean, so far, rural areas and rural provinces have been a little bit late to the party because, this virus really flourishes on highly dense areas. But we are beginning to see numbers rise in KZN. And then when we look at the astronomical rise in Gauteng over recent weeks, that Gauteng is almost married to a number of other provinces like Mpumalanga, Limpopo, and the Northwest. And who knows what we could see in the coming weeks as the virus spreads or people start moving from the big urban centers back to their rural homes.
What is it that can be done differently to better capacitate, especially the rural parts of our country right now? Because I suppose we can talk about the problems that are historical, but the current moment requires a very tailored solution that will be able to address the problems right now.
I think we need to, normally I think there's about 3 issues when we look at pandemics, and it's really about staff, systems and supplies. So I think we need almost like a national response to understand how this epidemic is moving, understand what capacities we have available. So when it's with staff, what kind of policies do we have to rotate staff within facilities, to move staff around when needs be, or to bring in new capacity. For instance, there's like 9,000 GPs that work in the private sector, but currently there's no contracting mechanism to bring them into the public sector response. When it comes to the systems, we've got situations where we've got a number of different provincial command councils and national command councils, and there's not really much coordination between the two or a plan to deal with the specific hotspots. We're treating everything almost like as a one-size-fits-all. Then when we look at supplies, one of the challenges that we've had initially is that on the one side we heard the Eastern Cape government telling us that they spend 100 million on PPE, but then when you talk to representatives from organized labor, that PPE is not reaching people on the ground. We also have a situation with consistent availability of medicines, poor staffing within primary healthcare facilities, and then we're referring patients into hospitals because we can't care for them at primary healthcare. So I think we need a total system response to ensure that we do the right things at the right time and are able to be adaptive to the situation as it evolves.
Russell, one also gets the impression that some of the issues that were being highlighted about 2 months back already by those in the healthcare sector, especially workers who are in communities, who are complaining about access to PPE, who are complaining about the systems that have been put in place, one gets the sense that was underplayed. Because for the past 3 months, we've been hearing concerns from healthcare workers, from nurses, and I'll stay with the example of the Eastern Cape. And we've been told that things are on track. right. The President, in his last visit to the Eastern Cape, said he was satisfied with how the province was doing and everything that they've put in place. But today we have the Premier of that province saying, in fact, our health capacity is overwhelmed and we need additional support. And when one traces the history of this over the last 3 months, we could have well seen it coming.
Cathy, I think you've entered into a very interesting aspect of this. You know, the politics in this pandemic has been part of the problem. You know, I think the political coordination, particularly in the Eastern Cape, has been very, very poor. And the result is we've politicized much of the response and tried to send out messaging to say that we're in control, but when in fact we weren't. You know, I think we need better support at the provincial level. We need to reconstitute, for instance, things like provincial command councils, which at the moment have really just included government and not any of the other health sector stakeholders like communities or civil society. And I think we're paying for that myopia now, because initially everybody wanted to say, no, we have so many beds ready, we've bought so much PPE, but when you look at the coordination at the political level, the administrative level, much is left to desire. Just 2 weeks ago, I was on a call with the health DG in the Eastern Cape, and they were saying, no, look, everything is not as bad as what it seems. You know, they're well planned. They know that the epidemic will be different in South Africa, but they got plans in place. And not even 2 weeks later, we're now sitting in a situation where today, cited in an article, the DG spoke about 3,000 additional beds required. And while at the same time, we're also hearing that there's no private sector capacity, there's no public sector capacity, and there doesn't seem to be a plan to take us out forward in terms of where we need to be.
All right. We certainly need more agile responses to this pandemic.